Hi everyone, this is Mr. Neil Wright, a consultant audiologist and founder of earwax. I've just got another demonstration video of our newly introduced product line called the Waxscope. So the Waxscope is an earwax removal device that incorporates a speculum attachment, and in this particular case I'm using the more standard 5mm diameter speculum bore, and it's used to dilate the ear canal wide open so we can then insert the instrument of use, and then we're currently using a Zollner suction probe. You can see here a slither of dead keratin that I'm just removing and peeling away. Just going back in. And then again, just stretching retracting the pinner wide open, inserting the speculum. The wax has got this glutinous appearance, this glossy appearance, which suggests there's a high composition of dead skin keratin, and you'll see at the end of the video a huge keratin tail, about 4 centimeters in length. And this is the keratin tail that we're slowly extracting. And I'm just re-entering the ear, and again just straightening the ear canal. And I'm going to adjust it so we can see the eardrum, which is nice and healthy. And co-founder of earwax. I'm just here demonstrating our latest line of earwax removal devices called the ClearScope. Whereas the iClearScope is an endoscope, the Waxscope is more of an otoscopic approach of visualizing inside the ear, and it comes equipped with various sizes of speculi, depending upon the size of the patient's ear canal. The speculi that I'm using in this particular video is our 4.25mm speculi. We've got one smaller, which is 3.5mm, and we've got actually two larger. The larger ones are a 5mm and also a 5.75mm diameter speculi. Now the Waxscope is going to be available to purchase from early autumn. And so if you're interested in this latest technology, please feel free to email info@clearwax.co.uk. We're still manufacturing and distributing our iClearScope as well. So the Waxscope is not designed to replace the iClearScope. It's designed for people who sometimes can find the endoscope difficult to use. An endoscope requires a bit more of a higher skill level because you're using both hands simultaneously to stretch the ear open whilst you're also removing the wax. With the speculum, as audiologists and ear professionals, whether it's doctors or nurses and ENT specialists, we're all more accustomed to using a speculum to straighten the ear. Of course, the view is you can't compare it to an endoscope, but the Waxscope was developed to be to provide the best alternative to an endoscopic approach of removing earwax, and I think we've really achieved that. So this patient's got kind of a narrow ear. It's fully occluding with wax and dead keratin. Already you've seen us use the Zollner suction probe and an ear hook, and we're using a Jobson horn here. We've also used the forceps. So the Waxscope is not limited just to microsuction. You're able to incorporate all the ENT instruments. You can see the speculum, we've got a lateral slit at the top, a slit should I say, and that was purposely designed to give more manoeuvrability. So with the instrument, quite often when you've got a speculi and you're inserting the instrument right through the centre of the speculi, it can be quite blurry, some of the part of the instrument, and that's because the whole instrument's in the line of sight, whether you're looking through head loops or some sort of magnifying lens or a microscope. And with an endoscope, I've been using it for many years now, I realised that the instrument was far clearer in the ear with less loss of focus. Because with an endoscope, you're using the endoscope at the bottom part of the ear canal and the instrument over the top. So it's at a higher angle of incidence. So it's a lot clearer, so you can visualise the wax a lot better. And therefore, with that in mind, I've developed the Waxscope to almost replicate the view of the instrument in the ear as it would be with an endoscope, because I think it's far clearer. Also, that slit gives far more manoeuvrability. You can really manoeuvre the instrument a lot more in the ear. And you can see we're just teasing this wax out. The ear canal's quite narrow there. Slowly but surely bring it forwards. We use some olive oil spray just to soften and lubricate the wax in the ear canal. And you'll see once we remove this wax, there's quite a good view of the eardrum as well. So again, the speculum just used to widen the ear. So this wax plug is trapped around the second bend. You can actually see the second bend there on the left, and on the right that's the first bend. So it's that junction between the first and second bends. And that's where this wax and keratin plug is blocked. There's quite a fair amount of wax that came out in the end. And slowly but surely we just bring this forwards. This is where I'm using the forceps. I thought I used it, I think I probably did use it before as well. The forceps, however, it just wasn't going to bring it forwards, it just cut into the wax and keratin plug. So just reverted back to microsuction, just adjusting the lighting there and the focus, and all this can be done on screen. So it's When I first used loops many moons ago, I found it really difficult to keep that focus level. So if the patient moved or I moved with the loops, and even with the microscope, the patient moves. With the microscope, it's a bit different because the microscope you can get itself can be fixed and positioned. But you're constantly having to try to readjust to get focus. With this, you just do it on the single swipe on the screen. It's so much easier. So you can see that ear canal is really narrow. So I'm using the speculum to stretch it. That's the first bend on the right. The second bend, we're now going to curl towards the second bend with the speculum. So we're stretching that second bend. We've got a lovely. Hi everyone, this is Mr. Neil Wright here, consultant audiologist and co-founder of Clearwax. We have here another video taken with the Clearwax wax scope. So the wax scope will be available to purchase early autumn. And it's the latest range of earwax removal device launched by Clearwax. We originally launched the iClearScope endoscope back in 2015. And the wax scope differs in the sense whereby it's more like an ENT microscope, but a handheld version. So similar to loops, but far more better magnification and focus and clarity. And so we have a speculum attachment, help to stretch the ear canal wide open, as you can just see there. It's a good illustration of that. So it dilates the ear canal. You can then orientate it towards the wax. And here this wax is very wet, dark. The patient had been using loads of softening drops, hence the consistency of the wax. And it's been there for a while, it's aged, hence this oxidized and the dark appearance. And you can just see how well the wax scope is working in action here. Not only can we really get good magnification on the wax, but good focus. And the speculum attachment here is a 4.25. We have a smaller one for more narrow ears, 3.5mm, and two larger ones, one at 5 and one at 5.75mm. And you can just see how clear the image is there. The suction probe's in focus, the wax is in focus. So the only difference really would be with the microscope is that obviously we're looking at a 2D screen. You don't have the same level of depth perception. I'll just come back to that in a moment. So you can see there's a lot of staining on the eardrum. We leave that, it's not going to affect the patient's hearing. It's quite wet, it'll all dry up now, but the patient's hearing's been restored. So the difference with the wax scope, the way you can develop depth perception with monocular vision. And if you've been watching all of the videos I've taken using the iClearScope, it's a good demonstration as to how you can develop depth perception even with a 2D monocular view. And similarly with the wax scope, so when you adjust the focus on the object that you want to be removed, that gives you the depth perception. So you can see here, adjust the focus. There we are, that's in focus. And when the instrument, in this case the suction probe, comes in focus, we know we're at the correct depth. So it is possible to develop depth perception just using molecular vision, and see we do that already with an endoscope. So we're just going to stretch this ear wide open, just here. There's a bit of dead skin, wax quite wet near the entrance. Again, I'm going to get this in focus, and it's so easy to get it in focus. It's just a simple swipe on the screen. You can just see how clear the suction probe itself looks. You may have noticed we're coming in at a higher angle with the suction probe, and we're trying to avoid the suction probe entering the ear at the same line of sight as the lens of the wax scope, because that can cause blurriness of the instrument. So there's the eardrum again. You can see that magnified view. Again, there's a bit of staining there, but that's all going to be fine. The patient's hearing is restored. Hello, this is Mr. Neil Wright, consultant audiologist and director and founder of Clearwax. We have here another demonstration video of the wax scope in action, and this is of a patient who attended with medially impacted dead skin, keratin and some wax. In this, the right ear, and they perform the cardinal sin of using a cotton bud, and it's right up against the eardrum, and we're just using the 4.25mm specula here just to dilate and widen the ear canal. And you can see we're inserting the Zollner suction probe. And because of the optics we have with the wax scope, the suction probe is always in focus. It's not in the line of sight, so it's not distorting the visual range of myself when I'm performing this. And you can see we're just removing some wax. This is more on the mid canal, on the posterior canal wall. You can just see the clarity, the definition of this wax and the skin. And in a moment, we'll be able to visualise the patient's eardrum, which is slightly inflamed. That's because the wax was impacted up against the eardrum. So the handle of malleus, there's some vascularis there, but it should settle down. Just got some dead keratin on the roof, well, more on the anterior, superior, lateral canal wall. Some dead skin is going to peel this away. It's going to be careful with any clarinetting. Now, what's great about the wax scope is infection control, hygiene. There's no chance of cross-contamination. The speculum, not only is it used to dilate the ear canal, but it's attached to the wax scope, and there's a sound bore, an instrument bore, should I say, in the centre of the speculum. So when you're redrawing the wax through the speculum, it's not going to come in contact with any other part of the wax scope, and speculums are disposable, so there's extremely reduced chance of any cross-contamination. And because of the fact that we're using this unique speculum designed by Clearwax, which we've applied for a UK patent, This device is actually a class 1 medical device. It doesn't need a class 2 certification. So class 2 certification is when, in the case of an endoscope, if there's a lumen there, so a cavity where you have to insert an instrument through, and that lumen to that cavity is not disposable anyway and it's being reused. There has to be proper sterilisation methods being used to do that. So with the wax scope, we mitigate that because of the disposable speculum. So this is the same patient in the left ear. This patient's ear canal is extremely bendy, and you can see to the left there, I was just managing to curl this wax plug, and keratin, there's a lot of keratin as well embedded. 60% of earwax is actually dead skin, but I would say this is a high concentration. And I've managed to just manoeuvre that around the bend. You have a bit of a close-up, and then again you'll see the patient's eardrum in a moment. We had to get a curl around that second bend of there, so you can see just how bendy that ear canal is. Some skin detached from the base of the ear canal with that wax plug. We're just getting the wax scope into focus, and now you can see all these blood vessels and capillaries on the posterior TM, and that's their eardrum. If you're interested in the wax scope, and that's the still image of the tail of keratin that I removed, so in fact it's 4.5 centimetres. If you're interested in the wax scope to enhance your clinical practice, please feel free to email info@clearwax.co.uk. Thank you, bye.